All right, if you can see me live, hit me up here on Facebook. Streaming, so you can hit the thumbs up, subscribe. It helps the algorithm, helps increase my visibility. If you're able to do that, that'd be great. So today, October is another breast cancer awareness month. And we're going to have a little chat about the causes and about prevention today. And it's probably, some of what I'm going to say is probably different from what you've learned in the media. There's not a lot of proactive or preventive strategy going on out there other than early detection. I've heard some stuff recently, them mentioning how the studies are showing that alcohol increases the risk. But other than that, there's not a lot of directive or a lot of attention that's being paid. Because it's really part of the medical industrial complex. There are a lot of people that are making a lot of money capitalizing on breast cancer because it's one of the top cancers for women. And a lot of things are happening with our environment, with our food, with the toxins that we're exposed to that are probably increasing our risk. They are not nailing that down, or they're not publicizing that a lot, because I think that in modern medicine, they believe that people don't want to change their diet. They don't want to change their exposure to toxins. They want to keep using toxic things on their bodies. And in some cases they're right, but I would say the majority of the people are interested in doing things that they can do to decrease their risk of cancer whenever possible. So please hit the thumbs up. Please share, subscribe, write comments. I'd love to see if you have any questions. I'll, write questions back if you type comments. So let's see here. Today's episode is going to be a shorter episode because I'm participating in a summit this weekend. October is full of educational opportunities, so these Facebook Live episodes are going to be a little bit shorter than usual for the next month or so. But today we're going to talk about breast cancer. October is Breast Cancer Awareness, and we are going to talk about what kind of things increase your risk of breast cancer, and what kind of things can you do to mitigate your risk for breast cancer. So just by nature of being female and having higher estrogen levels in the blood, that increases your risk of getting breast cancer. Also, as you get older, you have an increased risk of breast cancer. Having a history of breast disease, like people that have had trauma to the breast or have had infections in the breast tissue, or the lumpy bumpy breast, which is fibrocystic disease. These all increase the risk of breast cancer. Having a family history. A family history and the genomics is kind of interesting because if you really look into the literature about this BRCA gene, yes, the people with that gene, the BRCA1 and 2, they have increased incidence of breast cancer. However, we're finding that in functional medicine, we look at other genomics like methylation, like your ability to detoxify. And most of the people that have that gene have some significant issue with detoxification. Well, I should say, if they have that gene and have breast cancer, there's usually some significant issue with detoxification. And the detoxification issues are usually surrounding like heavy metals or detoxifying substances that require multiple pathways to detoxify. I'll give you an example. Like, for example, if you eat beef, the beef could be treated with a hormone, or it could have increased amounts of dioxin in its fat. And dioxin is a toxin, and dioxin is a mimic for our hormones, and so is the BHT that they use in cows to make them, it's like a growth hormone, and that mimics our estrogen. And so the response in the body is that we have more sensitivity. So let's see. Our estrogen, the response in the body. All right, so I was just making sure that the sound is working here. So anyways, if there are problems with methylation in the liver, if there are problems with other detoxification pathways, then we can see problems with the cells responding to increased amounts of hormones that it's thinking is estrogen, but it's really not. And estrogen is a type of growth hormone. It causes cells to proliferate. So just a second, let me check. Somebody's trying to send me a message here. Okay. So obesity is tied to breast cancer. And obesity has to really do with insulin sensitivity and blood sugar and glucose. So I would say that really that's tied to insulin regulation. So, and we have many, many people who are overweight and obese in the United States. Some is because we're consuming too many processed foods, but some of it is also because they are doing things to the food that we're not aware of, and it's not on the labels. And this is hard to prove, but it is going on. And I think that's the reason why some people are having trouble with insulin sensitivity. So I spoke about genomics. Genomics is important because we want to know, what genes are active and which ones are inactive, and how can we activate genes that can help with detoxification. A lot of it has to do with environment and stress, so we need to pay attention to that. So the amount of time that the body is exposed to estrogen, higher estrogen levels, has a lot to do with it. So the folks that have their periods at an earlier age, and now we're seeing young girls, like 8, 9, and 10 starting their periods, and that's because they're being exposed to what we call xenoestrogens or environmental estrogens. I mentioned one of them, which is dioxin, BHT, which is in beef. BHT and growth hormones are in the milk. Milk does not necessarily work for a lot of people. So plant milks may be better choices, but I digress there. people that reach menopause at a later age are exposed to estrogen for a longer period of time. So that's another risk factor. Having a child over the age of 30 um, is also another risk factor, and it has to do with the exposure time to the um, hormones. Having no pregnancy is also a risk factor, and when you go through pregnancy, it mitigates and it modulates the different hormonal levels. So that's also an increased risk factor for breast cancer. Um, they don't mention this on the list on the Mayo Clinic. They mention exogenous hormones in post-menopause. However, birth control pills in the early days had estrogen. And actually, in people that are middle-aged now, they may have taken birth control pills that had higher amounts of estrogen than the birth control pills that are available now. So the birth control pills that are available now have been better engineered to have much lower hormonal levels. So that has to be a risk factor. It may not be prominent in the research, but this is something that middle-aged people think about, and we know. Also, alcohol is a big risk factor, and I mentioned that in the beginning. And I also would add to the list that the Mayo has on their website, lack of exercise, which probably goes into the obesity category, or the lack of insulin sensitivity, because a lot of women that are in marginalized groups are not getting adequate exercise unless they have a physical job. And a lot of women just disdain exercise. And exercise keeps kind of the metabolism humming and keeps metabolic byproducts under control and processed efficiently. So I think that lack of exercise should also be added to that list. But exposure to radiation is a cause of concern that we talk about in functional and integrative medicine. And we get a lot of exposure to radiation in taking air flights, and people don't think about that. It's not just the getting scanned to get on the plane. It's actually sitting on the plane for a length of time. The plane generates a lot of radiation, and depending on how high up you go, you get more exposure to radiation from the atmosphere. So anyways, radiation is a major risk factor. And then, not to even mention that often when you're getting x-rays done, you have to pay attention and ask for the clinicians that are doing the x-rays to cover up the thyroid, to cover up the parts of the body, especially the ovaries and the organs that are not, that you don't need to see on the x-rays. We need to ask for these parts to be covered up, because I've seen studies that are correlating exposure of thyroid, because then that gears down the production of thyroid hormone. That affects the metabolism. That can contribute to insulin issues, glucose issues. That can contribute to problems with the metabolism. So, and then also, you get the direct radiation to the breast when you're getting chest x-rays or getting the chest x-ray. And you have to think about how many times women are getting mammograms. Um, and if you look this up for yourself, you can see that there are studies that are correlating the amount of radiation from mammograms and the frequency to some of the increase in breast cancer cases. And this is documented in the scientific literature. And so we need to be aware of this, and we need to be asking people or the doctors who are ordering the mammograms, do you really need this at this time? Is an ultrasound indicated if you're following something? Are there other studies that can be done other than submitting yourself to radiation, which we know is going to increase the risk of breast cancer? Mammogram is not the greatest preventive tool. It is an early indicator, so it will find a small tumor, but it will not prevent anybody from getting breast cancer. It will only show up something that's diagnosable when it becomes calcified or looks cancerous. So mammogram is not the best tool for prevention. There are studies, like now people are doing ultrasounds, they're doing MRIs of the breast, but in functional medicine, we recommend thermograms. Thermograms, which are done with infrared, can be done of the entire body, but when they're done of the breast, and if they're done by a practitioner who's experienced, they are able to pick up increased rates of metabolism in certain areas of the breast prior to disease forming. There's also been the development recently of what they call liquid biopsies, which are blood tests that look for cancerous cells that have been found to be effective for breast, colon, and a couple of others. So you may have to do some research to find out some of these companies. One of the companies that I knew about just got out of it, and I think it's because they had regulatory pressure in the United States. Germany is kind of a country that's front runner in this liquid biopsy area. And there are a couple of companies in the European Union that have tests that are approved over there, but not here. But people are running the test here, so you just need to find a doctor who is running those tests if you're concerned. So prevention is also very dependent on self-exam. And there are lots of videos out there on YouTube. There are pictures at your doctor's office, and there are pictures on the web of how to conduct the self-exam. It's important to do it the same way every month and to look for lumps and bumps and to report those to, your primary clinician or someone who can help you with trying to figure out how to image it and what to do about it. I just realized too that one of the areas that I didn't mention that I've seen studies on, which is interesting, is that heavy metals, especially mercury, coming from the mouth, like if you had silver fillings, those silver fillings could have leached mercury and leached it into the bones in the jaw and in the body. And then that mercury can also come out of the mouth and go down the lymph nodes, down the neck, and down into the chest. And they're seeing some correlation with the silver fillings and with forming breast cancer in the breast on the same side as where the silver fillings are. So you may want to seek a biologic dentist to get an assessment if you still have silver fillings. You may want to find someone to help you to get an assessment of if you still have mercury in your body, because there are other effects that can happen from the mercury being in the body as well. So one last thing that I wanted to mention. So we talked about the causes, we talked about prevention. I will mention also that there are blood tests that we like to look at in terms of prevention. We already mentioned genomic tests and genetic testing, looking for genes that we know are associated, but we also want to look at the ratios of estrogen to progesterone or progesterone to estrogen. We want to look at the balance of the three estrogens, the estrone, the estradiol, and the estrione. And because there's a certain balance that needs to be there. And I would say that it's also important to look at cortisol, because if someone has adrenal function or cortisol problems or issues because of stress, which we're seeing a lot of now because of the circumstances that we're living in, when the stress is prolonged, it can affect the balance of the other hormones. So cortisol becomes a preference and the other hormones are thrown out of balance. So we want to look at thyroid, adrenal, and the male and female hormones, the testosterone, progesterone, the three estrogens. We want to look at those levels. Sometimes we need to look at the sex hormone binding. We also need to look at the DHEA, and we need to look at the blood sugar, A1C, and the insulin. So all these hormones are all tied together. We have 600 hormones in our body. So it's not an easy picture to decipher, but we can see where there are issues sometimes. We also need to look at heavy metals, as I mentioned. And we're looking now a lot at the microbiome. So the first problem that a lot of people have when they've had exposure to toxins is that they have leaky gut. And you can see one of my other videos in the past to talk about leaky gut. I talk about leaky gut all the time, but we're not going to talk about that today. I'm just going to mention it so that you can go back and look at that, because that's often at the root cause. And I'm sure that they are going to find in the future that there are certain elements in the microbiome that are showing up before someone develops cancer, breast cancer, colon cancer, like all of these cancers. So I hope that just gives you a picture. One last thing that I'll mention is that when you're found to have a cancer in your breast, and they're going to biopsy it, many of these hospitals, and I would say the norm, is that they're using a titanium marker that they're inserting into the breast to mark the spot where they're doing the biopsy. I would urge you to do some research, because I was able to find that there is some evidence online in research that people develop inflammatory reactions to these titanium inserts, and that the inserts could themselves be a problem. Titanium is not benign to everyone, and often people may cross-react to titanium if they're allergic to nickel, copper, gold, silver, any of the other metals that are often in contact with the body. So be careful. There are doctors that do the biopsies without using the titanium markers. They're going to be harder to find, but they are out there. You will need to do some research and make some phone calls. So Um, be aware of what you're dealing with, and be educated when you go and see these surgeons, and when you go and see people um, before you have surgery. Make sure you do research to find out if this is the only mechanism of treatment, because there are other mechanisms of treatment. They are often not supported in traditional medicine or conventional medicine. So this is an area where you would have to do research. I love the site, The Truth About Cancer, because they make you aware of things that are around the world, they're available to you, that you may not be aware of. So I'm not a cancer specialist. I am a medical doctor. I'm an integrative and functional medicine doctor. If you would hit the like button, that would really help, and share with your friends. I'm going to come back every week this month. I'm going to do a small talk on some area about breast cancer that you may not know about. So I think today was packed with a few gems, and hopefully you took some notes. If not, you can look at this again. It'll be posted on my site. My site is Treat Yourself to Health on Facebook. On Instagram, I'm on Treat Yourself to Health. And on YouTube, Treat Yourself to Health. You can find out information about me on my website, treatyourselftohealth.com. If you would like to set up to see my orientation video, please hit the orientation video button on the website in the right upper hand corner, and give me your email and your phone number so that I can communicate with you. And I'd love to meet with you in the future, and hopefully you got some useful information today. Take care and have a great weekend. Enjoy the weather.